Senator Monning, then I'll.
Thank you, Madam Chair, and thank you for the comprehensive report and for the work you're doing. I'm encouraged by this inclusion of the whole person care, the more integrated, but it is described as a pilot. What determines, does that have to be initiated by a county? What determines, and is there a limit of how many can participate?
Sure. So we're still finalizing the process. So it will be an application process. Yesterday, we released some initial information as well as a non-binding request for information, so we could start to get information from those counties or other public entities who are interested in participating. So the only limit really is the fact that we have limited funding. So we have $300 million in federal funds a year. So that how many we'll be able to fund will really depend on how many actually apply and what funding they request and whether we can sort of satisfy all of that. And so that's the process we're working through. The RFP should be released, I believe, sometime in May, if I'm remembering my own detail. So we know that a lot of counties are interested. The other limitation is we do say no single pilot can have more than 30% of the money. So we have some large counties that might.
Read my mind. That was a follow-up question. And it is a county that initiates the application? So
it's either a county agency or another public entity. So it could be another kind of public hospital, a healthcare district, something of that nature. But then there are required partners, so they have to partner with other public entities, a managed care plan, as well as at least 2 other community-based organizations.
Presumably smaller counties, population-wise, will get equal consideration.
Absolutely.
Great, thank you.
Have you done any analysis as to kind of the who or the where they applied or the why in terms of the applications? Because I just have to say the kids, the 5,700 children under 19 surprised me, just I think kind of structurally, given my assumptions about how children can be accelerated through CalHARES. So have you done that?
It surprised me too. We just got that information sort of in the last week or so, and so that we are trying to look into why that's happening, because it should not be happening. Children should be getting accelerated enrollment.
That's what I thought.
Yes.
So once you get clarity on why that is, could you just let me know?
Absolutely.
And I'm glad to know that you are looking and trying to figure out the who and the what and the circumstances under which people are being brought in. So LAO.
Amber DG, Legislative Analyst's Office. As highlighted in the agenda, we had 2 major findings in our report on our analysis of the Medi-Cal budget. The first is that we find the administration's caseload estimates to be reasonable. However, we note that there's considerable uncertainty in projecting caseload, perhaps more so now than in the past, as a result of changes that have occurred during the initial phases of ACA implementation. We expect those changes to stabilize over the next couple of years, and then we hope that we'll be able to get a better understanding of how the ACA has impacted caseload trends. But that uncertainty does exist for now. So based on that, we recommend that the legislature require the department to report at May revise hearings on how the most recent data on caseload and redeterminations have impacted and changed their caseload projections. We also recommend that the legislature consider this uncertainty when making budgetary decisions, because even relatively small changes in projected caseload can have a large impact on the Medi-Cal budget.
Yes.
Our second major finding is that there are several potential changes on the horizon in Medi-Cal that could occur beginning in 16-17 and over the next several years that could result in increased general fund costs in the low billions of dollars annually. There are some changes that are more certain to occur, like the phase-in of the state share of cost for the ACA optional expansion, and the uncertainty there is just around how much that will cost. By 2021, when the cost share for the state is fully phased in, we estimate the cost will be between $1.4 and $1.9 billion. There are other changes where there's more uncertainty, such as the federal government's proposed Medicaid managed care regulations. Those aren't yet finalized. Once they are, we may have a better sense of the fiscal implications of those regulations. But the bottom line of our analysis is that there are these cost pressures on the horizon, potentially totaling the low billions of dollars annually, and we would recommend the legislature consider these cost pressures when making decisions about ongoing spending and reserves when crafting the 16-17 budget. So that's just a high-level overview of our analysis, but we're happy to answer any questions.
Thank you very much. Finance?
Jacob Lamb, Department of Finance. We'd like to note that the governor's multi-year projection at governor's budget does not include an extension of the hospital quality assurance fee. Historically, CMS has required a 6 to 12-month approval period when considering these extensions, and we are exploring potential options for working with the legislature for future extensions.
Thank you. Public comment?
Linda Way with Western Center on Law and Poverty. We appreciate the department's efforts to implement Medi-Cal expansion, but we do have concerns around the backlog. Specifically, the department estimates that over 22,000 applications are in the backlog. I'd like to note that this is applications, meaning that the number of individuals who are going without the care that they are entitled to could be significantly higher. Second, I'd like to also reiterate the chairperson's concern regarding the high number of children in the backlog. And thirdly, I would like to also raise some questions regarding the data that includes both Medi-Cal as well as Covered California. I wonder with the 1.6% estimate of the percentage of applicants that are in the backlog, that also includes Covered California applications, and so we think that this percentage is actually quite higher if you just look at Medi-Cal applications. Because
I got it. Got you. Thank you. Took me a minute, but I got it.
And Pam Ma with Health Access California. With regards to the Medi-Cal caseload estimate, we echo LAO's suggestion that the legislature require DHCS to provide updated caseload data at the May revise. And with regards to the backlog, we very much appreciate the progress that's been made over the last year to cut that down. And we continue to have concerns about the number of people who are still waiting more than 45 days to have their applications processed.
Thank you, Madam Chair and members. Kathy Senderling McDonald with the County Welfare Directors Association. With regards to the conversation about the pending applications, I have a little bit of information to share that I think might be helpful. First, I do want to clarify that we double-checked, and we believe this is an individual count, not an application count, despite the data being labeled as applications. I've had a staff person for the last 2 days, actually, conveniently, participating in a case review of 200 of the over 45-day cases with several counties. They dug into each and every one of the 200 cases. And so based on that, you can look at a couple of different data reports that aren't completely replicated here, but that have been provided in recent weeks by the department, and see that the individual counts match the number that is being stated as an application count. So I do think we're talking about individuals here. So the number of applications would be smaller. So a couple things that they found in this case review that I think you'll find instructive. First is, remember, this is a point in time. And by the time they looked at those 200 cases, 30 of them had already been dealt with. And so it had already been reduced by 15%. So any given point in time, you're going to see a different number, and it's going to go up and down. And that speaks to something else, which is we've always had a steady state where some percentage of cases didn't get done within 45 days. That's not always nefarious. If we're going back and forth with somebody who's applied, we don't want to just dismiss them and deny them out of hand if we're expecting them to provide information to us that we can actually use to confirm their eligibility. So you want to have probably some low, obviously, percentage, understanding that we're going back and forth with them. We know that's not the case with all of these. We did find some that hadn't been dealt with yet, some that were duplicate applications, as Ms. Cantwell noted, and also some that I'm missing my third things. Oh, and a few where there were computer system issues, for example, issues with reporting the eligibility to meds. Sort of two things that we saw is if you look at the data over by month, you'll see that there's about a 1% steady, that looks like a steady state through most of the year. During the open enrollment, it actually goes up to more like 2 or 3%, and that's probably a volume issue, and that's where you're seeing the cases that we just haven't had a chance to get to. Maybe this speaks to some kind of a targeted approach that we could look at for times when we know because this is probably going to keep happening every time there's an open enrollment. We're going to see this little bump, and we're going to go from steady state to Even though the numbers are small, it does matter for individuals to get that coverage. So we're happy to include, be engaged in those discussions. Like I said, I've got great staff who've looked at this over the last couple days and can provide some insight as well. The last point I want to make is regarding the children on this list. Yes. Only people who apply directly through the Covered California portal get accelerated enrollment for their kids.
Okay, so
this
if
is
I walk
actually,
in, if
you come to the county, you don't get it. It's a huge issue. We oppose that policy. We support accelerated enrollment for all kids, regardless of the door that they go into. We really appreciate Ms. Cantwell's comment that we hope the administration agrees with us on that point. The numbers are small. The kids are almost certainly eligible. We'd love to work with them to make sure that accelerated enrollment extends no matter what door you happen to walk through. And we would appreciate a continued discussion on that as well.
Could you just give me a little quick history lesson why the policy was differentiated?
Originally, there were so 15 years ago when I started at CWDA, there was no such thing as an online application. If you applied by mail or you walked into a county, basically. And so when we first started in the Healthy Families program and they created the online portal on the Healthy Families side, they started doing accelerated enrollment for kids over there. And at that time, what we said on our side was, we don't really think we need that because frankly, the volume still isn't that great in Medi-Cal. This was way before ACA. And if we're going to touch the application, we might as well just put them on coverage. And so we just kept processing. And there was never really that much of a problem with the fact that accelerated enrollment didn't happen when you came through the county door. Then we added our online applications. Then Covered Cal came into existence with its online portal. And that's when we started to say, wait a second, we don't want this accident of geography and of choice of a parent. And frankly, we know that often it's immigrant parents, non-English speaking parents who come in person to apply at the county. They're being disadvantaged by that situation. So a few years ago, 2012, 2013, there was actually legislation that would have required this to be built in and have the state do it. There was a signing message that was put forth, I think, that said we'll work with folks on that, and it just hasn't been accomplished. So reopening that conversation, having that discussion, and trying to get these kids into accelerated enrollment, I think it's time.
That was helpful.
Thanks.
There was no reason. It just fell through the cracks.
Kind of just worked up this way.
I got it. Thank you. Next witness, please.
Michelle Cabrera with SEIU California. I just wanted to thank the department and Mary for all of your hard work on getting our Medi-Cal 2020 waiver accomplished and pretty much on time, which is amazing. It is key for the continued transformation and success of our public health care safety net for Medi-Cal and our remaining uninsured. I also wanted to flag for the committee that currently the DHCS is planning a major overhaul to the California Children's Services Program. This issue will come before the committee in May, but it is of great concern to our membership as essentially we will be taking what is a managed fee-for-service program today, unlike anything we've seen, in prior fee-for-service transitions, and moving certain counties into managed care. This is, in light of all of the things that we're still trying to do to get our arms around provider networks and timely access and these sorts of issues, anything we saw with healthy families, with seniors and people with disabilities, with dual eligibles is just going to be heightened in terms of its importance and the concerns for this population of children. And so just wanted to flag that as something really big that's happening in the department.
Kevin Aslan, Coalition California Welfare Rights Organization. This is a pretty disturbing number, about 2,200 cases. And maybe we should have a law saying that if your application has been pending for 45 days, it should be deemed to be approved. And that should help a lot of people. Thank you.
Thank you, Mr. Zlanian. Next witness.
Good afternoon, Brianna Pittman with the California Dental Association. I know that we'll be talking more about the components of the Dental Transformation Initiative later in the Dental Cal issue, but just wanted to take this opportunity to say that we really appreciate all the work that the department has done in getting this into the waiver. We're very excited about the opportunities that this program provides and look forward to working with the department and stakeholders to make sure that this improves access to oral health care.
Thank you very much. Appreciate that. We're going to leave these issues open. We're going to move on to issue number 3. County Eligibility, Administration, Funding, and Trailer Bill, page 38 on the agenda.
All right, so my Department of Finance colleague will talk about the funding piece, but while she's sitting down, I will do the trailer bill piece. So just like we've done since 2008-9, we're proposing a trailer bill to suspend the COLA for county admin funding, given the augmentation that we are proposing to do that Department of Finance will mention now.
Finance.
Madam Chair, Senator Manning Guadalupe Manriquez with the Department of Finance. So the governor's budget includes an augmentation of $655 million. This is a $169 million increase above the current year augmentation for counties to continue to perform Medi-Cal eligibility. The administration recognizes the need for the augmentation given the continuous caseload growth as well as the ongoing development of the CalHER system. Finance, Department of Healthcare Services, the Health and Human Services Agency, and the California Welfare Directors Association conducted site visits of Medi-Cal eligibility offices in Los Angeles, San Francisco, and Riverside. The administration considered workload at the county level given challenges with CalHERs, as well as caseload growth to come up with the augmentation, the proposed augmentation. And once CalHERs is stable, the state will develop a new county administration funding methodology.
Thank you very much. LAO? Senator Manning? I'm going to open up to public comment. Let me just thank the department for all you've done on behalf of all the advocates in the room. Fair enough? So I'm going to ask advocates, just because I'm looking at the clock and we've got a lot of meaty issues, to really try to keep your comments within 2 minutes. And let's focus on the specific issue that we're addressing at this point. I know you guys are going to have to continue to come back up for other issues. I apologize for that. But I did all the thanking for all their hard work so we can get to the issues. First witness, 2 minutes.
Thank you, Madam Chair. Members, Kathy Sunderling McDonald with the County Welfare Directors Association. And just, adding my thanks to the administration and supporting both the augmentation as well as the budget trailer bill. Well, they really dug in, and I appreciate this. From our conversations last year, we were able to get folks out to actually see the operations. My staff and I accompanied them, so we were able to look over the shoulders of the workers and see what's actually going on out there. I think it was a huge help in driving us to the place where we're acknowledging both the CalHERs related workload and then just the sheer amount of work that goes along with a caseload increase of the magnitude that we've seen. It's amazing. It's great that we've seen that caseload. We got to manage those. And so that work and helping people understand what goes into that is extremely important. So we appreciate also the 2-year nature of the proposal. Obviously, a conversation we'll have again next year. You can't do a 2-year budget, but we really appreciate the commitment to have that funding available for 2 years, and then to follow that up with the budget methodology that we're also ready to dig in on, pick up where we left off a few years ago. We did some work pre-ACA on a budget methodology approach, so I think we'll probably start there. And Ms. Malo is smiling at me because we're going to dig in for some long days, I'm sure, and try to work together to come up with a mutually acceptable methodology that we can recommend to you for, I can't believe I'm about to say this, 2018-19. Thank you so much.
Thank you. 2 minutes.
Thank you, Madam Chair. Farrah McDade-Ting with the California State Association of Counties, representing all 58 of California's counties, in strong support of this budget proposal. Echoing Ms. Sunderling's comments, we do especially appreciate the 2-year nature of the proposal because, as you know, our county eligibility workers are on the front lines. Having some certainty, as much certainty as you can have in the budget process, that we will be able to have funding to support those activities of those folks is very helpful. And we strongly support the time and work study proposal as well. So it would help give the state and counties more certainty about where funding is and what funding they'll be getting. So thank you.
Tam Ma with Health Access California. We support this proposal and support giving the counties the resources they need to do this important work.
Martha Guerrero, representing the Los Angeles County Board of Supervisors. Thank you very much for the work, and I'm in strong support of the proposal.
Tim Lynch, on behalf of the Boards of Supervisors in Orange, Ventura, and San Bernardino counties, also supporting the proposal.
Joshua Golka with the American Federation of State, County, and Municipal Employees in support of the augmentation.
Good morning. Good morning. My name is Nilberta Ornelas. I am a SEIU 521 member. I live and work in Kern County as a Human Services Technician 3. I've been doing this work for 24 years. I applaud the $170 million augmentation. So many people rely on us to help them attain health care coverage. Up until recently, we were all working 16 hours mandatory overtime to deal with uncovered caseloads. These are cases that are uncovered for any number of reasons, including leave and turnover. I am on the liaison team. We fill the gaps by seeing clients and processing benefits for the processing teams. Last month, our team of 6 people saw over 1,700 clients. The first thing people say is, "Are you my worker?" And I tell them yes and no, but I can help you with your benefits. People are tired of the call center. They can't get through or get the answers they need, so they come into the office. We can usually take about 5 to 6 people at a time. So when we have 10 people, some wait a couple of hours. People are so desperate to get their applications and documents in. Many people, especially the Spanish speakers, tell me, "I don't care if I have to wait all day. I want you to know we are here to serve the public. We are more than happy to do it. We do not have enough people to do it as well as Californians would like. We don't want people waiting hours for care. Many of us skip lunch breaks to process as many people as possible, and with the 40% turnover, I am concerned that we are not retaining people who could help expedite enrollment. Please keep the $170 million augmentation in the budget. Please continue partnership, Department of Finance. Thank you very much for your time. Happy St. Patrick's Day to everybody."
Hi, my name is Tisha Adams. I'm a SEIU 1021 member, and I live and work in Amador County as an eligibility worker too. This month celebrates the end of my 4th year as that position. One of the biggest problems in our department is turnover, and I've seen my caseload grow from around 200 to 250 when I first started to maxing out at around 630. This means that I'm working 900 to 1,000 programs for my clients, and I cannot deliver my customer service experience to them the way that I like to. Yesterday, I had a client that didn't realize her child with heart problems and food allergies no longer had her Medi-Cal. I hadn't had client contact since August, but there was case management in there from CalHERS for last month, which discontinued the child. If she had ended up in the emergency room, I would have gotten the call that day. Instead, we spent hours fixing her case, which of course meant I couldn't deliver to my other clients that expected their phone calls returned. My renewal appointments got rescheduled. And so you can see where this is a constant problem. I do want to echo that many of the other eligibility workers have expressed similar complaints about the MAGI budgets not being transparent. That was one of the biggest issues why my call went on for hours. I do definitely have some fear and concern, but I am so anxious and ready for that money to come to my county so we could hopefully get some employee retention. Thank you.
Again, Omar Medina with Sonoma County and with SEIU. I do want to add a special thank you to the Department of Finance for collaborating and working with the SEIU Statewide Eligibility Task Force on listening to the issues and helping push for this additional funding. I just want to add that these huge caseloads and the need for workers is critical, because these caseloads not only add to the delay of service, but it's more work because people come in more, they call more, and this creates more work just because they don't have their aid. So they keep coming in, and every time they come in, we have to serve them, and that delays the time that we get to work on the cases. So we're really looking forward to this funding. We really appreciate it, and we definitely would like to be a part of working on that new budget methodology. Thank you.
Elizabeth Landsberg with the Western Center on Law and Poverty in support of the budget item. We certainly call county workers when there are problems, but we are very aware of their dedication and the incredible workload they've had over the years. And even though Madam Chair already stipulated that we thank the department for their work, it is staggering to think that there are 4 million more Medi-Cal beneficiaries. It's sobering to think that that many people are poor enough to qualify for Medi-Cal, but if they are, we're appreciative that they have health care. Thank you.
Hold this item open. Moving on to issue number 4, Medi-Cal eligibility systems workload, AB1X1.
Yes, Karen Johnson, Chief Deputy Director, Department of Healthcare Services. So we are requesting limited expenditure authority equivalent to 20 positions and contract funding, as well as 4 permanent positions based on contract conversions. We're requesting these resources to support ongoing policy and system initiatives from the Affordable Care Act. After implementation of CalHERS Medi-Cal Eligibility Division and Information Technology Services continues to provide contract oversight and reporting for changes to eligibility rules and processes. These resources facilitate the ongoing development on needed interfaces, as well as to ensure ACA eligibility, simplification, and to ensure success of the 24-month roadmap.
Excellent. I don't know if you were here when I went on my rant about reports that are due that are late. So there are some reports that are due on AB 1X1 and they're overdue. Do you have any information in the time frame that we can expect to see them?
Hello, Madam Chair. Renee Malo, Deputy Director, Department of Healthcare Services. We're expecting them around April 1st.
April 1st, and you'll make sure that the committee gets them as well?
Yes.
Excellent, thank you. April 1st. Thank you. LAO, anything on eligibility system workload? Finance? Public comment?
Elizabeth Landsberg with the Western Center on Law and Poverty here in support of this request. We know all too well how staggering the changes with the Affordable Care Act have been on the Medi-Cal program. We met initially weekly with the department about all these changes and implementing them, now biweekly. We were very involved in the special session bills, and I know the number of times that we told them they had to do new regulations. It's very important for advocates and consumers for the regulations to actually reflect what the law is, and that's not the case now. So we're supportive of making sure the department has the resources to make sure these reg packages are updated. And we share the legislature's looking forward to seeing the ABX11 report. Those are really important numbers for us, so we look forward to seeing that. Thank you.
Next witness.
Tam Ma with Health Access, and I'll have to say it's ditto.
Great, thank you. We'll move on now to issue 5, page 40 of the agenda, outreach and enrollment extension.
Sure. So this is a request for 2-year limited term expenditure authority to continue 4 positions that we have. This is the work focused on the outreach and enrollment grants that counties and other organizations get. And so we have continuing workload and need to continue those resources.
Any comment from LAO, Finance, public comment?
Linda Way with Western Center on Law and Poverty. We support this.
Tam Ma from Health Access also in support.
We'll go ahead and hold this item open. Moving on to issue 6, newly qualified immigrants.
Sure. So just as background, California has historically provided full scope Medicaid coverage to adults who are newly qualified immigrants who don't qualify for federally funded Medicaid because they've been here for less than 5 years. As part of the overall ACA legislation in 2013, we were tasked with implementing an affordability wrap program so that for those newly qualified immigrant adults who don't have children in the Medi-Cal program would be shifted to be provided instead comprehensive coverage through Covered California and be able to receive federal subsidies for that coverage. And then Medi-Cal would come around and pay any additional costs that they would have, so it's still zero cost to the member, as well as provide any benefits that are not covered by the Covered California plan. The goal here was to still ensure that everyone has access to comprehensive coverage, but this was enabling us to have savings in the Medi-Cal program since the federal subsidies are available to these individuals, and so shifting some of that cost to the federal government. So this does result in savings to Medi-Cal, given that the cost of the wrap is less than the cost of the full scope coverage. So for the budget year, that's about $82 million total funds, $32 million in general fund savings. So obviously, this was tasked back in 2013. The program hasn't begun yet because of other priorities. All of the systems conversation we had earlier, didn't allow for the changes to CalHERS to occur, but we now are scheduled to have that happen this year, and so we're planning for this to go into effect in January 2017, so with the open enrollment that happens at the end of this year. We will be sending outreach letters to eligible individuals in August, and then the counties will have the notices that they send in prior to the open enrollment period. We will also be working to develop any additional educational materials and FAQs and things of that nature to make sure that folks are aware of what they need to do and what choices they have in front of them. And we will be developing those, obviously, in consultation with our various partners. I know one of the questions is about how we've engaged stakeholders in this transition. And, again, the program was delayed, and so we had engaged stakeholders, then we stopped, and we have re-engaged, and certainly recognize the importance of having that engagement. And so we have begun to have, again, every other week meetings with various stakeholders. That also includes our Covered California colleagues, given their role in this program, to discuss the implementation of this program. So far, we've been able to share a few things in terms of our process flow charts and drafts of notices, and we've received some initial comments, but there's some more stuff that we'll be sharing out in the next week or so. So in terms of the timeline, we're working to finalize the notices with the stakeholder input in the next month or so that we're ready to have those go out in August and October. And again, also looking at what other types of information we need to make sure is available to the beneficiaries. In terms of the systems changes, we have worked through the details of that. The initial and sort of the bulk of the changes necessary for this are scheduled for the July release. And then the final changes that would include the actual plan selection piece for the special plans for these beneficiaries are scheduled for the November release.